22. It's the first of the month, by the way. And he is the head of the governor's economic recovery
panel of advisors.
Yes, and also he's on the recovery panel of advisors, and he led the... I always confuse him. He led the presentation of the governor's recovery panel of advisors recovery plan yesterday. Dr. Ricky Hernandez from GITA. Morning, Ricky.
Good morning.
Good morning, Sabrina. Hi, good morning, Sabrina.
I guess, so what are some of the things that you've been hearing in the time after you presented the plan? Because we're kind of still just taking it all in.
Yeah, I think that, there is a lot to take in because, this is unprecedented times. And so, just as a precursor to this, this Talantara Hinemnu plan was a culmination of obviously the work of the governors and really specifically a recovery panel of advisors, because it's not only economic recovery, but it's also the recovery of our health, right? And so I think the name is befitting of the intent of the plan, which is Talantara Hinemnu, which, journey to healing, road to recovery. And so it's a good balance, and it was, if you'd imagine, we had the panel is made up of physicians as well as business people that have obviously different interests, but we came together for a common interest to ensure that we have, something that we could, just a roadmap that we could follow and everyone could try to take in and absorb, so that we kind of understand how we can get to a place where we're all a little bit happier. I think that's kind of what we're going toward.
What would you make of criticisms about the lack of diversity on that recovery panel of or the economic, or any of the groups for that matter? People are saying pretty much the only dissenting voice, I think, would be Christine Belletto. Everyone else is either tied to the administration, works for the administration, or somehow otherwise connected. So how confident are you in this plan, and how many outside eyes got a look or a say on it?
Yeah, I think the diversity question, and I can't speak to the definition of connection, because I think all of us are connected in some way. But I think in terms of the voices that went into this, Christine Belletto was an amazing resource, because the Chamber of Commerce obviously is a representation of a broad range of businesses in the community, and so bringing her voice in, as well as Holly Rustick, who's the president of the Guam Women's Chamber of Commerce, and their ability to, in terms of just the sheer number of researchers that assisted in developing this plan, I think speaks volumes to at least how many people in the diversity of who spoke into this, who had a voice in this plan. On the physician side, that we presented this to the physicians advisory group as well, and so the triggers that we finally came up with was a culmination of discussions with a broad number of doctors and dentists and just physicians in general. And so, in terms of diversity and the number of individuals that we had spoken with, both obviously with the most amount of voice in it, which is obviously the recovery panel advisors, and then also from a contributor and a reviewer standpoint, we feel pretty comfortable. And let me just add this too, Chris and Sabrina. This was not also created in a vacuum, right? We looked at other studies and recovery reports and reopening strategies that other states have and jurisdictions have put together. And if you look at those studies, I mean, you kind of have a national perspective. We also looked at the president's Opening Up America Again roadmap, and we attempted to tailor a lot of what we were trying to do with the sheer number of experts that went into that plan as well. So in terms of diversity, we're hoping that that this plan kind of incorporates as many voices, and right. we think it did.
Ricky, was this plan approved by the Department of Public Health? Because I noticed that I don't believe I saw Linda Mpingo Denorsi at the press conference, and why wasn't she there?
Yeah, so the Director Denorsi was heavily involved in this. Obviously, I mentioned Department of Public Health and Social Services probably the most out of all the agencies in this plan. And at the end of the plan, we mentioned that they're the source of the information. They're the official source of information that will that will be informing the governor in terms of what these triggers that will help inform a decision.
Right.
Linda may not have been on camera, but she was there. She was there in person, so she's totally involved.
Ricky, in the CNMI they had their fiscal summit, which it was an exchange of ideas and it was broadcast to the public. Why weren't these economic recovery meetings put out on Zoom for the public to watch? You mentioned that you didn't do this in a vacuum, but you actually kind of did, because there was no ability or access for the public or the media to kind of peer into these plans. And do you think that that's a problem when so much of the conversation about the administration right now is geared around transparency?
Yeah, I mean, that's a good question. I'm not too familiar with what the CNMI did. What I did do is I did look at what they had submitted, and I know that they're working with a great group out there from the federal government called Graduate School USA, which is a contractor with the Department of Interior Office of Insular Affairs. And I've worked closely with some of those individuals, and it appears that they've provided a lot of technical assistance to the CNMI government, which is always great, is always helpful for the territories and other insular areas. As it relates to transparency and openness, essentially what we've done is we've laid out a plan that we've said is not perfect. We've mentioned that this plan is obviously something that will evolve. It's not set in stone. And so, as much feedback as we get, obviously this is not something that we're not open to amending at some time. But obviously, in terms of just trying to put out a roadmap, how we pave the way, obviously, depends on what experiences we have moving forward. We couldn't have done this kind of plan, I'll just say 2 months ago, because maybe 2 months ago we didn't know some of the details of how this virus spreads. And so I think in terms of input and diversity, or the perceived lack of diversity or the perceived lack of input, I hope I addressed that in that last question. But moving forward, I think this is not a plan that is static. It's an evolving plan, because the data is evolving and the data that we get is improving in terms of testing capacity and all that. So,
But Ricky,
again, do you think that this should have been something that with DOE they have work sessions? This is kind of like a work session thing. I mean, so you're basically saying that you don't think it should have been aired out to the public, or you know what I mean? Because I didn't really catch your response to that.
Yeah, no, I think what we're doing now is airing it out to the public.
Okay.
And like I said, if we say up front that it's not, it's the best plan we have at the moment,
right?
And it's a roadmap for people to start planning. I think in terms of how flexible this plan is a testament to how flexible a lot of frameworks are created around the country, and so in terms of input and all that, I think that's what we're trying to do with these industries and businesses that are working together to put together plans so that we could keep everyone safe. It's a joint effort, and we're hoping that the input from the business community and how they believe they should operate from a self-regulatory basis or a self-regulation basis is something we can look forward to.
Okay, we can get into the plan in a little bit, but I wanted to first just give you the opportunity, because we did have Mike Israel on earlier in our program, and I'm not sure if you heard him, but he called the plan basically a nothing burger, and I wanted to see if you had a response to that.
Oh, I'm not too sure. I didn't hear anyone's perspective on the plan on your show earlier today.
Okay, well, he called it a nothing burger.
Okay.
And then,
yeah, no, I mean, I think that I think there's a lot of opinions out there that are well respected, and I think that as we move forward, I think we all should probably stay positive as it relates to this, because
stay positive. Got it.
Yeah, no, and I think in terms of the negativity that may surround any idea that comes out, I think it's inevitable that there be criticism of anything that comes out.
Ricky, what about Uncle Carl? So we had made the ask because we had heard that he wasn't being included in any of these discussions, and when we asked at the press conference, the governor's response was that, she's going to go to Tago Tony Babauta to call him, and so we had later found out through a variety of sources that he was involved in the latter stages of these plans. Can you just first tell us why it was so hard to loop him in? And then secondly, what type of input and experience did he provide in the finalized recovery plan?
Yeah, we all have a lot of respect, obviously, for the Governor Gutierrez and his input and his experience as it relates to his relationship with the governor. I think is a world of difference for any decision that's made. And so, in terms of his relationship and his role with the governor, I think that that's something that I'm not familiar with, because that's I'm the deputy administrator at the Guam Economic Development Authority, and so he's obviously an employee of the governor's office.
But isn't he kind of detailed with you guys, with Gita? Because I remember the governor saying that he works closely with Gita as the economic. Yeah.
No, certainly the former governor does work very closely with Gita as well.
How come you guys didn't have him at the presentation of the plan?
Chris, I think that in terms of the logistics of how the plan was rolled out and who was at the press conference, I think that might be a question for probably presented to someone else, because I think in terms of my
Wait a second, Ricky, are you only taking questions on the recovery plan? Because I wanted to ask you what you thought about the muting of reporters. And I mean, you seem like a pretty smart guy. I saw you sitting there. It must have been so uncomfortable for you guys to not to be able to answer, real questions that people. I know you guys did your plan. I know you guys worked hard on your plan, but there's a lot of other things that are going on here, and it almost seemed to me like a spoiled kid's birthday party. You're like, we're only going to talk about our recovery plan. So, what did you make of that censorship of the media?
Yeah, I'm not too sure exactly, what the problem was in terms of being able to, just being able to just talk briefly about the plan itself. I know that the spoiled birthday party may not be an accurate representation of what the plan was.
No, I'm not talking about what the plan is. I'm talking about how you guys. And let me just back this up, Ricky. The governor hasn't had a press appearance or an availability for the public or the media in 6 days. So the last update we got on the federal aid, the last update we got on the unemployment was over a week ago, and you can't just leave people hanging out here. And people want to know about the federal aid. So it was like a spoiled kid's birthday party, and that the number one question on people's mind isn't about your recovery plan. I'm sorry, it's not. It's about how people are going to recover out here and how much they're hurting because they thought they were going to have the stimulus. They thought they were going to have the unemployment. And again, you seem like a smart guy. I don't know how you can defend a decision like that, because it was kind of boneheaded.
Yeah, I mean, I can't speak to the actions, quite frankly.
Do you agree with that decision, Ricky, or not?
With which decision?
With the decision to limit the questions to only the recovery plan.
Well, I think I'll just answer it this way, Chris and Sabrina.
How about you answer it with a yes or no, maybe?
Well, I think that the recovery plan and the intent of trying to make everyone understand something that obviously is a very difficult thing to kind of comprehend at first.
It's not that difficult, Ricky. I mean, so yes or no, do you support how the media was censored yesterday?
Well, in terms of censorship, I think in terms of providing an outlet for the media to have responded to or to hear about the plans that the administration has, whether or not it's recovery or whether or not it's a previous press conference that they've been having. The access to the administration, I think, is
limited. It's very limited, Ricky.
I'd say it's through its communications office, first and foremost. So I'm not the communications office, but of course, obviously, I'm willing to answer any questions as it relates to what I can answer. And so my ability to answer questions in terms of the reason I was hoping we could use this as a public service announcement as it relates to the plan and any questions that you may have. But if further questions as it relates to the decisions that are made, I hope, and I'm hoping that could be presented, to those that have answers to those questions.
Right.
Well, the reason why sometimes you see reporters just asking questions is we're limited to 2 questions. So obviously, as a reporter, okay, the odds that somebody else is going to ask a question about the recovery plan, they're going to ask a question about the recovery plan.
Right.
But they're also going to ask something else. And sometimes when you get a response, it's not really a response, it's just a load of BS.
Yeah, I think you're just on that side of it, Ricky.
Yeah.
So
But
maybe
that's fine.
you don't have the
Yeah.
you know, our perspective of it, which
You've
is
got to say what you've got to say.
yeah, and you're saying it.
Right. So
Oh,
anyway,
yeah.
you guys, yeah.
We're not going to mute you, Ricky. We're not.
Yeah,
we're
don't
going to be
worry.
the better people here. We're not going to mute you. So go ahead.
No, I'm just going to say that I opportunity to be able to, you know, talk about the plan.
Okay, well, we can talk about the plan.
I mean, you
alright?
work for the governor, dude. You're like one of our shining stars. You should be able to stand in and answer the questions. You know what I mean? You're more than well compensated. They put you out there, Dr. Ricky Hernandez. I'm just saying, you know, put on your big boy pants, and if you don't want to deal with this, then we won't deal with it. We want to know about the plan, yes, but also this is the elephant in the room, and it's only fair that we ask this. And if you don't want to respond to it, then fine.
Yeah. Did you get to stay at the Pacific Star?
Did you get to
Sorry?
stay at the Pacific Star, Ricky?
Oh no, of course not.
Okay.
Oh, of course not.
Okay, so anyway, so we got the pandemic condition of readiness, PCOR 1, maximum restrictions. This is the recovery plan. PCOR 2, moderate restrictions. PCOR 3, minimum restrictions. And PCOR 4, no restrictions. And so the way that I read it, it appears that you're dealing with 14 days, right? Intervals. So from when you move from 1 to 2 to 3 to 4, correct? Based
Yeah, no,
on,
that's correct.
I'm sorry?
Yeah, that's correct.
Okay.
So the plan in terms of the triggers to, so we're currently in PCOR 1, and the triggers to get to PCOR 2 is there's four things that have to actually occur at the same time, and I think that the number one thing that people are looking at are cases, right? And so there has to be a 14-day period of downward trend in terms of positive cases, and then also what we call test positivity.
Mm-hmm.
And so those two have to be occurring, as well as, you know, obviously adequate hospitalization, contact tracing has to be robust, and testing capacity has to be there.
Okay.
And so the 14 days, I believe, is tolling from April 25th. And
Right.
so, yeah, from April 25th, you know, if you count 14 days, and if all these triggers occur, then that may, you know, obviously provide the governor some surety that you know, the beginning of reopening the economy can occur.
Right, and then you guys mentioned that May 9th, that might be the day we're looking at, but that's all pending whether or not we're good with the 4 triggers.
Yeah, and I think it's important to note too that this time of waiting until that date is a time for planning for both government and the business community. So you know, it kind of matches up well, because we want to make sure that when businesses that are authorized to open are able to do so in a way that it keeps the public health safe, the public's health safe, as well as, you know, obviously following certain social distancing guidelines and all that.
No, I think the public gets it. They know what they need to do. Obviously, we haven't gotten this far if we didn't heed, you know, what,
And, you know,
what
Ricky,
we're supposed to do.
I got to say that you did give credit to the public yesterday. I did appreciate that in the press conference. You're right. I don't think the public has been thanked enough, quite frankly, because we're the ones who went out and did what we had to do.
Yeah, you know, and to that point, Chris, and you know, I'm glad you recognize that point that was made by you know, it was a point expressed by everyone in the room. But I think that you know, we wouldn't be at this point where we're even talking about recovery if it wasn't due to the diligence of everyone, you know, everyone in the community. You know, you go to a grocery store, and you know, what were social norms of, you know, just not being you know, being close to people and all that. Everyone is, you know, it's a different place out there now, and I think that's a testament to people's respect for each other and trust in terms of, you know, just wearing face masks, although they're required. I mean, people are wearing face masks and keeping their hands clean and sanitized and things like that. And the results are showing it. You know, the testing and the low test positivity rate that we've been experiencing, even with ramping up the number of tests, I think is a testament to, you know, people's, just overall the community's response to this virus.
So when May 9th, I believe May 9th was the next for the possibility of PCOR 2, what businesses are we looking at reopening on a limited capacity?
Yeah, you know, there were some on that. There was a
Right.
slide there that we had. Yeah, there was a slide there that we had on the bottom. Obviously, it was a little bit of a what do you call it, a disclaimer, because it wasn't an exhaustive list of businesses that were going to open, but the ones on the left side of that slide in terms of retail stores,
automotive sales,
automotive sales, and
shopping centers and malls.
Shopping centers and malls. All of those types of businesses are obviously going to operate on a limited basis, and what that limited basis will obviously be dependent on what we are able to see over the next week in terms of some of the plans. But currently, I think when we did move into some of the restrictions being implemented over time, we did lower the occupancy rate, and in other states, occupancy rate has been lowered. Even for those businesses that were allowed to open, to I think some states did it at 20, 25, 30%. I think ours before we ramped up the restrictions was at 50% occupancy. So that is yet to be determined until the time when PCOR 2 is actually declared.
Right, but in the interim, did you go out to all these businesses that deal with retail, real estate, beauty, shopping centers, elective, medical, and dental? Did you say, here's our plan, and give me yours on how to reopen, and then we'll approve you, yes or no?
Yeah, the approval process, we had thought about that in the panel of advisors, and the government approval process would have hampered the ability for these businesses to open. But in that process, obviously, I mentioned the Chamber of Commerce and the Women's Chamber had met with a lot of businesses, and in terms of that, they submitted some interim guidelines that basically show just something as simple as point of sale systems. They mentioned that, and this is just one example, a point of sale system should be used by one person, and in between uses, if there's a shift change, then it has to be completely sanitized. So there are these steps that these businesses are taking in terms of submitting some type of guidelines that help prevent the spread of the virus.
Are they required to submit this plan?
Yeah, so on an industry basis, the Guam Chamber of Commerce and Women's Chamber were willing to work with the business community, as well, in terms of their membership, as well as others, not their members, to work together to submit industry specific.
Right. Yeah. So they go to their members, and whoever owns like a hair salon, they're like, hey, this is how we would do it. Let's put this together. There's going to be social distancing. We're going to do appointments and all that. And then they present it to you guys.
But you guys don't have to give the green light. You don't have to be the ones to say, okay, yes, you can open. I'm just saying, can they just open with their own, what they plan to do?
Yeah, and I think that's where the trust and the self-regulation come in, right?
Okay.
And it was a balance. It was a balance between enforcement and just not having to hamper the ability of businesses to open. I think that's where the kind of the collaboration occurred in this panel.
We had a comment here, Ricky. How are people going to buy if they don't have money? And this is kind of that chicken and the egg argument we've been talking about. So we want to reopen things, but sad reality out here is who has money.
Yeah, I mean, obviously that's a problem all over the states, and so I think in terms of the people's ability to purchase things, I think that's probably been an issue that's been around even if we weren't
right, but people don't want to hear what's happening in the States. They want to know what's happening here and what we are doing about it.
Yeah, this whole it's in the States, no one's getting it. Oh, yeah, it's not. That doesn't fly with me. I mean, we're here.
You get that, right? Yeah. You're a PhD. The people don't.
Yeah,
and that's why people wanted to ask about it at the press conference, Ricky, because it's so important, and people just are suffering, and so. While you may think that, we didn't keep it germane to the topic at hand, I don't think you understand the gravity, and I don't think really, I doubt people sitting in that room understand the gravity of how desperately people want to hear. Like, do you know anything about the status of the federal aid or the unemployment, Ricky?
Yeah, I think the government of Guam in general is very focused on trying to get this federal aid. And I think at the Department of Revenue and Taxation, the director, Daphne Shimizu, has been furiously just trying to get everything in motion. And so I think my understanding of where that is in the process is that a plan has been submitted, and I think it's an implementation plan has been submitted, and is still is awaiting review by the IRS and the Treasury.
Right. Yeah, we've heard that. Yeah. So is there any plan? Is there any plan to provide any local aide? Has anyone been talking about that? Do we got
a
group of advisors maybe that can?
Is there like a help the local people advisory panel? Help the local people while they're suffering out here because you told everyone we were going to have our stimulus check by now. Panel of advisors.
Yeah, no, I think that obviously
that'd be a good one to put together, Ricky.
No, I believe so, and I think Chris, Sabrina, I think that in terms of when the stimulus checks are going to come out, I think they're coming out as quickly as we can.
Right, I'm not talking about the stimulus checks, okay? There's federal aid. Yeah, we get it. It's not coming for a while. Everybody around America is having a problem with it. I'm talking about the local bridge programs, locally funded. Is there any sort of advisory group, any advisors that are saying, hey, you know what, we need to focus on the people of Guam that are lining up at Grab and Go, that are trying to get assistance through SNAP? Is there anything out there? Anyone working on it?
Yeah, so I mean, you make those good points, and I know that those are federal. I know that those are partially federal or federal programs, the SNAP and Grab and Go. And I think in terms of all of these programs, I know you're specifically asking about local programs, and I think in terms of the ability to fund these local programs, and I hear you. I hear that if I tell you that the governor had fronted $11 million of local funds to start paying the rebate checks, that may not be enough in the eyes of a lot. But I think
but there's $118 million from CARES Act funding that came down. That you got the U.S. Treasury guidelines that said you could use it for this. You could use it to help the people.
Yeah, and I think in terms of the ability to deploy the funds, obviously the guidelines have come out, and I know that there's probably some hesitancy in terms of how to use those funds because although
we already know $7 million is going to go to pay for quarantine. That just came down yesterday.
Okay, yeah, I'm not completely involved in the budget side, obviously, in terms of the use of the funds and how those funds are can be used and the guidelines surrounding that. I know that the governor is looking to try to deploy those funds into the community. But in terms of how those funds will be deployed, and if those strategies are within the guidelines, that's something that I think that's something that's being looked into. And so if you think about trying to deploy funds, I think if you just kind of break that process down with all these social distancing mandates that are obviously mandates because of the reality we're living in. I think in terms of trying to figure out how to deploy it such that we don't have to have people come in and apply and have that back and forth with the government. If there's a way we can identify a data set of people that are targeted to such that we can give the money to them in a manner that kind of ensures that we're sensitive to social distancing. I think that's what is probably as important as trying to get that money out.
Yeah, but I think how you do that is you just work on getting the money out. Someone just puts their head down, we just get the money out, get the money out, and then someone else is working on logistically, how are we going to execute this plan? It shouldn't be like, oh, we don't know, it's going to have to be so hard.
Yeah.
Okay, Ricky, I think we kind of, is anything else you wanted to add here? Or maybe we could get you on next week, and then we'll strictly focus on the recovery plan. Unless there's another terrible press conference the day before.
Well, Chris, I just want to thank you. I took up about half an hour of your time.
Hey,
thank you. We're not coming from a mean place here. We're just coming from how people are really frustrated right now.
And I feel like we're well within our range of what's professional and what's not.
No, and I just want to thank you for the opportunity. I think that there's a lot of hurt that's going around in the community, and I think that we're all, even each other, I think we're all trying to do our best, and for some that may not be enough, for others it's more than enough. But I think if we all work together, and I think if as we've done, and we wouldn't be here at this point talking about reopening if we hadn't. I think if we continue that movement toward not positive testing and the being positive, I think that's something that hopefully will get us to a better place than we're at now.
I think we can agree on that, Ricky.
Thanks again
Thank
for
you.
the work you guys put into the Talent para Hinamelu program. You can find that on our website and all of our social media platforms.
Sure.
Thanks again, Ricky.
Hey, Ricky, last question. Someone had commented, are you on the government of Guam haircut plan? Because I saw you. Do you just do your own hair or what?
I was very prepared for this question, Chris, and
I know.
The way I want to answer that is that don't underestimate the skills of a wife.
Okay, I
So
got you.
I'll just do that.
So is she taking outside appointments or what? Can she cut from 6 feet away? Okay.
Well, let's hope by May 9, if we all remain diligent, that that could happen.
All right, Ricky. Thank you. Wash your hands.
I will. Thanks.
Thank
Chris.
you.
All right.
Thanks.
Okay, bye.
Okay, 7:43. We got to take a little break. Got a bunch of calls coming in here. It's the KUAM News Takeover, Guam's favorite I-94. Good morning.
Staying healthy.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the